for a fair and balanced debate. Two members of Congress from opposing sides of the aisle. Democrat Loretta Sanchez of California, she's a member of her party's centrist Blue Dog Coalition, and Republican Tom Price of Georgia, a practicing physician for more than 20 years. Thank you both for talking to us. Loretta, your reaction to Republicans who say that Democrats are ignoring the public's concerns when it comes to health care?
Well, first, thank you, Julie, for having me on, and Tom, good to see you. I actually have been in my district all weekend long. I've just had 2 meetings with different types of groups here. I've got 3 more when I leave from here in my office, talking to patients, talking to seniors, talking to groups, interest groups who are out there giving information. I think it's really a matter of getting the information out, because when you know that there are no death panels, for example, then you understand that that's just a bunch of rhetoric flying, that we really need to understand what do we want to get accomplished, how much is it going to cost us, who's going to pay for that, and how are we going to implement this. And I believe that most of my colleagues, and especially my Democratic colleagues, are out there explaining to people, having town halls. I've had 3. I've got another 2 more scheduled. And people are not screaming or yelling at each other. They're actually asking questions, asking how it will affect them, how it will affect their families. And it's been a very good dialogue.
Yeah, but, you know, Congressman Price, the president has made it obviously a point to engage the public. But it seems that the more he tries to address what Democrats call misinformation and half-truths surrounding health care reform, the less Americans trust him. So something's obviously not working here. Maybe Democrats need to do a better job of explaining their position on health care to show that they are already listening.
Well, thanks, Julie. It really isn't a new explanation that's needed. It's a new plan. The fact of the matter is we came back in September, and it appeared that the Democrat leadership and the president ignored August altogether. They just dismissed what the American people were saying to them, which was slow down. Take a look at this plan. We are not interested in having the government take over our health care. We're not interested in a plan that costs $1.3 trillion. We want to make certain that patients and their families and doctors can make medical decisions. And we're not interested in being tossed in jail if we don't get the insurance plan that the government wants us to have or demands that we have. And that's what the Senate plan currently is. So the American people are shouting loudly and clearly, the Democrats are out of touch and we need to step back and start again.
All right, Congresswoman Sanchez, I want you to react to a Fox poll because it shows that Republicans may actually have a point here. A recent Fox News poll finds that only about 1/3 of the public thinks Congress pays a great deal or some attention to regular Americans. According to that poll, what do you think? I mean, do you think it's possible, just, you know, maybe try to look at both sides here, whether Democrats maybe need to actually do a better job of listening to Americans, because it doesn't seem that the Americans think that they are listening.
Well, again, I go out and I talk to people. I come home on the weekends. I work Saturdays and Sundays. I certainly have been listening to them. And I think if you ask the question, do you like your member of Congress, that it's always the case that the majority of people like their member of Congress. They're just worried about it as a whole lumped group together. And that includes Democrats and Republicans, by the way. So I think if a member is out in their district and is working and talking and really putting out the information. And, you know, I just want to correct one thing that my colleague Tom said right now, and that is that that there's somehow one plan out there. There is not one plan out there. There are many plans out there. They're being whittled down. We're having more discussion on it. We're having a push and a fight to try to make sure that what Loretta Sanchez's people out here want is ultimately in a bill if they want me to vote for it. So I think that one of the problems is that there isn't one single plan right now. There are 2 or 3 or 4 right now, and we've whittled it down from a lot of different people, a lot of cooks in the pot, you know, a lot of people stirring that pot, and now we're down to 2 or 3 or 4, and we're trying to get the best, and we're trying to make sure that as we work it, that it works for a majority of Americans as far as getting accessibility and affordability.
Americans are just confused.
And coverage.
I mean, there's so many plans. How are we supposed to choose which plan we want if there's so many of them? I mean, Congressman Price, I'm going to give you the final word, and maybe you can explain.
Sure. The fact of the matter is there are some principles around which we all ought to congregate, and that is that people ought to have access to affordable health coverage. We ought to make certain that it doesn't break the bank. All of the Democrat plans have significant increase in taxes and slash Medicare. We ought not allow
Well, yeah,
that.
and the president
We wanna
says there
make
will
certain
not
that
be a
patients-
tax increase. How can there not be a tax increase for his health care plan, that the middle class will not be taxed? He swears by
Well,
that.
the fact of the matter is the president doesn't have a plan on the table right now, but every plan in Congress increases taxes. On the Democrat side, increases taxes and slashes Medicare. And that's not what the American people want. And so we ought to step back, work together in a bipartisan way, and come up with not a Democrat solution, but an American solution. If we do that, we'll move in the right direction.
All right, Congresswoman Loretta Sanchez and Republican Tom Price, thank you very much for both of you coming on. Thank you.